talking. Our topic for today is going to be perineal lacerations. I'm excited to talk about that. I'm going to share a little bit of, what is a laceration? What stages are there? What degree? What does each degree mean? And kind of the repercussions that can have on the pelvic floor. I've posted a few things about that this week, so hopefully you guys got a chance to look at those. And then we're going to talk about kind of the phases of healing. So what happens after the laceration, after you go home, as you're continuing to heal from your birth, what's your body going through? And then we're going to talk about some of the things that can potentially make a difference in those tears, whether it's preventative or whether it's afterwards, you can make a huge difference in how your laceration heals. So we're going to talk about that a little bit. We're not, I'm going to try to keep this relatively brief. And of course, as always, it's very challenging to say anything, medical advice wise on a Facebook Live. So nothing that I say can be construed as medical advice. This is purely for your education. And I would definitely encourage you to talk to your birth provider about just what your options are and what the current evidence is on prevention and dealing with these types of things. So that being said, we'll go ahead and move forward and start talking about perineal tears. So what is a perineal tear? It's a very common thing that happens during birth. And the prevalence of this, which means like how many people get tearing or how many people get lacerations. And laceration is just a fancy word for either scenario, whether it's a tear that happens naturally or an episiotomy. Both are considered a laceration. So, and both really have very similar stages of healing, whether it's a wound or a natural tear. So the prevalence, generally speaking, across the board is about 80 to 85% of women who birth a baby vaginally are going to have some stage of perineal tearing. So that's a really high number, right? 80 to 85% is what the data kind of has shown. So I kind of like to take a positive outlook on that when I share that number with people, because I know a lot of women who I see pre-birth are they're terrified of tearing, right? So they've potentially heard a horror story about really painful tear or poor recovery, if they've read an article about some horrific experience. So a lot of women are really quite terrified of tearing during a vaginal delivery. And I think in my mind, that 80 to 85% number should be very encouraging to you, that this is a pretty normal thing that happens during a vaginal delivery. Dare I say it, the majority of women who have a vaginal delivery are going to have some stage of tearing. So this is something that has been happening forever, since humanity. And it's something that the human body is absolutely prepared to deal with and heal from and manage. Okay. So if you are currently pregnant and terrified of having a tear, please take a breath and just rest in knowing that if this does happen, it's not the end of the world. You're going to recover from it. Odds are you're going to be fine. Then we kind of start to segue into, well, there's different types of tears. There's different degrees of tears, right? So the vast majority of women who are having perineal tearing during childbirth, it's going to be one of those lower stages. So there's four grades of tears: grade 1, 2, 3, and 4. And by far the most common are grade 1 and 2, much less common grades 3 and 4. So the numbers that I saw in kind of a brief literature review is actually, they're not super concrete. Out of that, 80 to 85% of women who are having perineal tearing during delivery, you're going to have this. What I saw showed anywhere between 2 to 3% are a grade 3 to 4 tear, up to even as close to 30% for first-time moms. So first-time moms have a little bit higher incidence of tearing in general, and that seems reasonable. If you've already had a vaginal birth, your tissues are kind of already a little bit stretched out. They're used to stretching. They've been through the birthing process. They know what to do. They know what to expect. You know what it feels like. You're not as nervous. So there's a lot of reasons why first-time moms might have a little bit higher incidence of tearing, but certainly, those higher percentages of prevalence for third and fourth degree tears are more seen in first-time moms than second or third-time moms. So, and those numbers, like I said, anywhere between 2% and 30%. So that's a really big range, but it's a much smaller percentage still than that overall number that's going to have some degree of tearing. Okay, so what does each degree mean, right? Well, it's pretty simple. The first degree is going to be very minor. They often don't even require stitches. It's skin only, so it's just a little bit into the tissue. So I don't have a model that has skin on it, but in this little diagram, which I love, a first degree tear isn't even going to show up on this, right? Because the skin's been removed from this diagram. So a first degree tear is just into those first layers of your dermis. It's like cutting, it's like a paper cut, right? It's like cutting yourself. So don't be too nervous about a first degree tear. Okay. I'm not saying that they can't still cause some repercussions and some pain and some scarring, but by and large, first degree tear, not a huge deal. Okay. Second degree tear is going to go through the layers of skin and then into a little bit of muscle. So you're going to hit muscle there. You're going to hit some connective tissue. You're going to hit a little bit deeper stuff. So those second degree tears often will require some stitches. And I have found by and large with my clients and with myself, well, with myself, I asked what degree I had. But by and large, you're not going to be told what degree your tear is. And that's something that you can always ask. So if you're curious, if it's on your mind after your baby comes out and you're kind of settled, you can always ask, or if they are stitching you up, ask your midwife or your physician, like, incidentally, could you tell me what degree tear that was? Is it in the front? Is it in the back? Like, how severe do you think it is? But I don't want you to stress too much about that in that moment. You should be focused on that beautiful little baby that's on you and bonding with the baby. But you can always ask, and it's a good idea to ask your provider at some point before you leave the hospital, what degree tearing did I have? How many stitches? Are there any particular muscles I should be concerned about in terms of my recovery? You can always ask that of your obstetric provider. So that second degree tear is going to go through skin and it's going to go into a little bit of muscle. So when we talk about musculature that it's hitting, right? So this is the more superficial, sorry, I can't figure out which way to point it. So this is a more superficial pelvic floor musculature. Okay. So you've got a muscle called it's mirroring me. Okay. Bulbocavernosus, right, goes around the vagina. Maybe I should look at what I'm doing. So bulbocavernosus goes around the vagina, right? You've also got some superficial muscles that surround the urethra. You've got your anal sphincter that goes around the anus. You've got muscles called your transverse perineals and your ischiocavernosus. So these are all kind of your urethral and vaginal types of muscles with the exception of the anal sphincter. But these guys are the ones that could potentially be impacted by that second degree tear, okay? So when we get into a third or a fourth degree tear, now you're talking about getting well into your pelvic floor musculature and fascia, okay? So if we look at the pelvic floor, right, these are all different muscles. So pelvic floor has a lot of different muscles in there. There's also fascia, tendons, connective tissue, and nerves, okay? You can't see the nerves on this nice little diagram, but the post that I just did on a day, or I think it was yesterday, did show some of the nerves. So when we talk about a third or a fourth degree tear, so this is the vaginal opening. So now you're getting into muscles called your pubovaginalis, your puborectalis, your pubococcygeus. So these are levator ani muscles. Okay, so these are your deep control and stabilization muscles. These are the muscles that really lift and support the vaginal canal, the anal canal, the rectum, the urethra, and the bladder. Okay, so these are deeper, much larger muscles, and your third and fourth degree tears are going to impact these guys. Okay, so they have typically a larger impact on your function overall after birth. So with a third degree tear, you're going to get from that vaginal canal into potentially your levator ani, potentially all the way to your anal sphincter, okay, but not through your anal sphincter. So a big tear, but not all the way through. Fourth degree tear is your doozy. Okay, so fourth degree tear is your doozy where you're going all the way through those layers of muscle and then through the anal sphincter into the anal. So you have now like a complete tear between those two passages. Okay, so it sounds really scary, but your physician or your midwife is going to stitch you up and it should repair nicely. Your body knows how to heal a laceration like that. It should repair, it should heal as long as you treat it kindly. And we'll talk about some of the repercussions and what you can do if you have one of those higher degree tears. But those are the four grades, okay? And with an episiotomy, so the tearing is more of we think of that as like a natural laceration. With an episiotomy, it's a man-made laceration, right? And these are not super common anymore. Episiotomy, if you don't know that term, is where they're actually clipping. So they're going to cut into the skin and the muscle to try to make the vaginal opening larger for your baby to fit through. So it's a tool assisted, okay? So with episiotomies, they grade them pretty much the same way. You can have a stage 1, 2, 3, or 4. So an episiotomy isn't necessarily going to be a larger degree tear. It might just be a little clip. The caveat to that is if you think of my favorite analogy that I've heard about natural tearing versus episiotomy clipping is if you were to take a sweater or a t-shirt and it's got that nice seam along the edge, right? So we saw these muscles, it's got this nice seam, right, along the edge. And you try to tear that. You stretch it and you stretch it and you try to tear it. It's not going to tear very easily, right? But if you then clip it, even a little tiny clip, and then you stretch it, it tears a lot more easily. Right. So the reason that there's been a reversal and a much bigger a movement with all of the larger health organizations related to obstetrics and gynecology with perineal tearing is to minimize the use of episiotomies, because you could potentially have a episiotomy that's going to make that natural tearing a little bit worse and your outcomes aren't going to be as good. So that's why the current recommendation from the World Health Organization, from ACOG in the US, is to really avoid episiotomies unless it's absolutely necessary. So they don't do them as standard practice anymore, which is a good thing. So that's one thing potentially to ask your, as you're going about choosing a healthcare provider for your birth, asking them, like, when would you use an episiotomy? What would your indications be for that? What other things would you try with me before doing an episiotomy? So have that conversation with your provider so that you know where they stand on episiotomies, and you can align that with where you stand. Okay, so you can do your own research on that. But an episiotomy is essentially, it's a laceration, just like a perineal tear is. It can be different grades. It's an instrument assisted at the discretion of your birth provider. If they need a little bit of assistance, if that baby needs to get out quickly and they need to help that happen, then they might choose to do an episiotomy to help to save the baby, right? So that's important. There's some arguments that they do it to potentially prevent a higher grade tear, but from what I've read and seen, there's not as much evidence that that's an effective way to prevent higher degree tears for the mom. So that's episiotomy. There's another type of tear that I just want to mention, and this isn't, I don't believe, technically considered a perineal tear. It's called a levator ani avulsion. Okay. So an avulsion is where you have muscle that's actually tearing away from a bony attachment. So you can have an avulsion of your rotator cuff, for example, where one of your rotator cuff muscles will kind of pull away. Hamstring avulsions are one that people might have heard of, where your hamstring kind of tears away from where it connects to your pelvis. So a levator avulsion is where these deeper muscles that we talked about, the levator ani, might tear away for one of their bony attachments, either on the what we call the ischial spine here, or the coccyx or the sacrum. So where they attach to the bone, they might kind of tear away a little bit. So those are deep tears, and your physician or midwife may not even know that that's occurred. Okay, so that's important to remember. And we're not going to really talk about levator avulsion, but I just want you to be aware that that's another type of tearing that can happen and can impact your function afterwards, that very likely you wouldn't know going home from your birth if you have that or not. So I just want to mention that it's out there, right? But I don't want you to be terrified of it. Okay, so perineal tearing prevention. We get these kind of questions a lot, like, how can I prevent from tearing? So the first thing I would say is, based on our first, comments, we know that perineal tears are going to happen, right? And potentially over 80% of women who birth vaginally. So first, I want you to put in your mind, it's not necessarily your fault or in your control. Okay. So hopefully that's encouraging to you. Like, take a little bit of the pressure off yourself. Are there things that you can do and focus on and prepare for, ways that you can prepare and things you can talk to your birth team about? Yes. But if you end up with a tear, even though you did all the things, please don't blame yourself, because this is a very common outcome of birth. It's not something that you should be blaming yourself for afterwards, thinking, I did such and such wrong, and this is how I ended up here, or my birth provider did something wrong, and that's why I ended up with this tear. Try to avoid those kind of thoughts, because they're usually not helpful for you in your emotional and psychological recovery from your birth. And there may not have been anything that you could have done to prevent it. So try not to place that blame on yourself, okay? But in terms of prevention, the evidence tends to be very mixed. And I want to first, right off the bat, refer you to a website that I love called Evidence-Based Birth. She has a ton of information, a ton of literature reviews, and you can have a better understanding from reading all of her stuff about the incidence, the prevalence, the research on what can actually help prevent or not perineal tears, because you're going to hear a lot from different providers about what does and doesn't help. So I would encourage you, if you're pregnant, to do that research on your own. And then once you've done the research, you've read the literature, you've read the reviews, kind of come up with your own, part of your birth plan. What do you want to include in your birth plan? And then talk to your birth provider about that and about how your birth institution is going to go about supporting you in that and implementing those desires. But a couple of the things just to think about and look into, birth position. So, are you laying down in a lithotomy position with your feet in stirrups? Are you standing up squatting? Are you using a birth stool? Are you hands and knees? Are you side lying? Are you in a tub? What position are you in the tub? That has been shown to potentially have an impact, okay, on the amount of tearing and the amount of tearing, okay, and the incidence of tearing. So that's something to look into. Also, warm compresses is one of the things that in the literature has been more supported. Using a warm compress on the perineum during second phase, so during your pushing, warm compress has been shown. Yes, I will. Erin's asking for the link to Evidence-Based Birth. I will post that in the comments after. Yeah, great question. It's an awesome website. What was I talking about? Warm compresses. Okay, so using a warm compress on the perineum during pushing, between contractions, between pushes, has been shown to potentially help, okay, with preventing tears or with reducing the severity of the tear. It feels really good. I didn't have it in my first vaginal delivery, from what I recall, because I wasn't aware, but I did a little bit more research before my second one, and I did ask for it, and I talked to my providers about that on the front end, that was what I wanted as the primary, during pushing to prevent tears. I wanted that, and they said, oh yes, absolutely, we will do that. So, and they did do it, even though my pushing phase was not that long. They did do the warm compresses, and it felt wonderful. So warm compress is one that's a little bit more supported in the literature. A lot of people ask also about perineal stretching, especially since I'm a pelvic PT. I use perineal relaxation techniques and relaxation training, and sometimes stretching in my practice. In terms of birth preparation and tear prevention, the literature on this, again, is mixed, and Evidence-Based Birth does a phenomenal job of going through the evidence on perineal stretching. For first-time mothers, that has shown to potentially be a little bit helpful in the last few weeks before your estimated due date, to do a little bit of perineal stretching. The way that you do it, the frequency that you do it, is important, and I'm not going to get into that, but you can talk to your midwife or a pelvic floor physical therapist about that, and have them show you how to do it effectively. And again, I would say more leaning towards teaching you how to relax and how to relax into the stretch versus actually physically stretching that tissue is where we're wanting to go with that type of intervention. So that's an option for you to look into. Instrumentation has absolutely been shown to increase the instance of birth trauma. Okay, so we want to avoid vacuums and forceps and things like that, if at all possible. So again, talking to your providers before your birth about your plan, in what instances are they going to use forceps or other types of instrumentation, so that you're prepared for, okay, what's going to happen in my labor that would cause them to go down this road, so that you're mentally prepared for that. And that you know that when it is necessary, because sometimes it is, right? So instrumentation. And then coached and uncoached pushing. So the evidence is very supportive of uncoached pushing, right, at this phase. So we want to be letting your body do what it needs to do to push that baby out, for you to be present in your body and able to sense when to push. And that's where it's, again, really important that you trust your birth providers to coach you if you need a little bit of coaching, because especially if you're a first-time mom and you don't know what pushing is like and you have no idea how it's going to feel or how to do it effectively, talking to your doula, your midwife, or your OB or your pelvic floor therapist before your birth to walk through, do you know how to push effectively? Do you know how to find your pelvic floor versus your abdominals? Do you know how to lengthen and how to let go? Because that's really important in helping your body to birth versus fighting your body during that pushing phase. Okay. So coached versus uncoached pushing. Typically we want uncoached. But again, if you're having something like, if you have an epidural and you're not really feeling what's happening down there, you're probably going to need a little bit of coaching. So then you want to be really trusting who's coaching you, right? That they're doing things that would be consistent with your desires in terms of your birth plan and your outcomes. So trusting your providers is huge. Okay. Okay. So that's a little bit about prevention. We're not going to talk any more about that. But again, I would refer you back to evidence-based birth and also to have a conversation with your providers, your birth team. So physiologic wound healing. So a laceration, whether it's a natural tear or an episiotomy, it's a wound, right? It's a wound. So you have this birth, you have this beautiful little baby at the end, but you have a wound, and potentially you have some stitches in that wound. Potentially you have a little tiny cut, but potentially you have a large wound that goes through multiple layers of muscle and fascia and ligament and potentially nerves, so all of those things can be impacted, and your body is going to heal that just like it would heal any wound anywhere else in your body. So there's 3 or 4, depending on who you ask, phases or stages of wound healing. Okay. And a lot of people lump, 3 or 4, a lot of people lump the first 2 kind of into one phase. So that first phase is going to be the hemostasis, or the inflammatory and hemostasis phase is that first phase. And that's hours, right? That's like hours to days. It's the first 48 hours-ish of when your body is it's in an inflamed state. So it's sending all of the things to that area. There's blood flow, there's chemo, all different things that your body sends to start to put down something, a scab, right? To put down something to block the bleeding, to clot, to start to fight any infection. So your immune system is working big time during that phase to send everything, all your body's armies of things to start to heal that spot where you're potentially losing blood, and it's a wound, right? So your body wants to close that up and start to heal quick. So that's that first, a couple of days. Then you should start moving into what we call the proliferative or the granulation phase, which is kind of days to weeks, right? So it's that first, end of that first couple of days up to potentially 4 weeks, where your body there's other things that are happening with your immune system, again, breaking down that scab and starting to kind of put different types of tissue there. Again, your immune system is working to limit infection, and your body is doing all kinds of things in that wound to lay down some new tissue. It's still a very raw phase. It's still a very delicate phase. It's still a phase where we need to be in a protective mode of that wound. Okay. So your primary goal in that first and second phase is protecting the healing of that wound. Okay. And that's potentially up to I think what I read was 3 to 4 weeks, 24 days, something along those lines. Okay. So again, I'm not a wound specialist, but I, we do learn this stuff in physical therapy school, and I do try to review it periodically. And I have a great diagram. I'm not sure if I can figure out how to share my screen. Hang on. I can't even figure out how to close my chat. There we go. Yeah, unfortunately, I am not that good at Facebook Lives where I know how to share my screen. Maybe by next time I'll figure that out, guys. Sorry. So maybe my next time. So I'll maybe send a link to that as well. I'll post a link to that too in the comments later after this is over. And then okay, so we have first phase and second phase up to a few weeks, right, of that granulation proliferation. So then you have epithelial tissue that's kind of covering that wound. So you don't have as high incidence. Your bleeding should be going down. You don't have bleeding from the wound, not bleeding from your uterus. Okay, that's different. But you shouldn't be bleeding from the wound anymore. And the tissue should be at least have a couple layers of nice epithelial tissue in there to kind of keep your bloodstream safe and all those things. So after that, we're moving into now the third or fourth, depending on who you talk to, stage, which is going to be remodeling or maturation. Okay. And that's the phase that we can start to kind of do some things to help your body lay down the best tissue to heal that wound. Okay. So those first couple of phases, that early few weeks, protect, right? We're protecting. Then you get into the phase where your body has closed off. There's not much risk of infection there at the wound anymore. Now your body is starting to break down the tissue that it had prior placed to just stop the hole, right? Now it's going to start laying down better quality tissue. It's going to start laying down a scar, right? So it lays down a scar, and then over a long period of time. So the maturation and remodeling phase, wait for it, can go from that 3 to 4 weeks to like up to 1.5 to 2 years. Yay. So again, we always hear like postpartum is not 6 weeks. Okay. Postpartum is 1 to 2 years. Okay. So even that perineal tear, especially if you had a third or fourth degree, it can take a couple of years for that tissue to get back to normal. And the things that you're doing with your pelvis and with your body during that time are going to impact how that scar remodels, how your body lays down tissue there, and the quality of that tissue. And it's been shown, not just with perineal, but with wounds all over the body, for that 1.5 to 2 years, you're only at about 50% of your normal tissue strength. Okay. So that tissue is not at its prior level of strength or ability to withstand forces, with ability to withstand things that you want to do in your life. It's not there, potentially for 1.5 to 2 years. Okay. So when you think about, did I have that third or fourth degree tear that went clear through my levator ani, through all of these layers of muscle? And these are not just bladder and bowel muscles. Remember, these are core stability muscles. So if you had a tear that went all the way through there, or sorry, again, I'm not, this is a mirror image for me, so I'm confused. But if your tear went all the way through these multiple layers of muscle, now those muscles are necessary for you to stabilize your pelvis and your pelvic organs, your trunk, your spine, your hips, when you run, when you walk, when you squat, when you lift, when you do all those things that you need to do in your life and that you want to do at the gym. You have tissue there that if you had a scar is not at its full strength for up to 2 years. Okay. So please keep that in your mind. So yes, that's all I will say about that. So we talk about these phases of wound healing, those first couple phases up to the first month or so after your birth, you are protecting that tissue. Starting at a month, we're starting to think about what can we do to stimulate that tissue to heal better, stronger, in better types of orientation for the fascia, the ligaments, and the muscles, to start to strengthen those things, move them toward a good, healthy healing process versus overloading or overtaxing them. And then as you get past that initial 6 to 8 weeks, things are, your scar is in good place. You have a nice, healthy scar there. Now we start to look like, can we start to kind of remodel that scar to be even stronger, and then continuing to heal that in a positive way for the next year as it continues to remodel and recover. Okay. So that's going to move us into what are the things that we can do, right, to help you have a better healing after a tear, whether it's a grade 1 or a grade 4. right? So the first thing I want to mention is nutrition. Okay, postpartum nutrition is so important. And I am not a nutritionist. I'm not a dietitian, but I read about this stuff and I try to be up on it to the extent that I can help my patients know some of the basics, right, to do. And then absolutely, I'm going to refer you to someone who knows more if you need some help with this. But nutrition, you need to be hydrated. Your body needs water. You need hydration to heal well. Okay. You need protein to heal well. Your body is laying down connective tissue, it's laying down muscle to fix that gap. Okay. And if you're not giving it the building blocks that it needs to do that, it can't do it effectively. So you need vitamins, you need minerals, you need protein, collagen, right? So one of the few supplements that I do recommend as a physical therapist in postpartum healing is some kind of collagen protein, right? And I have my favorites, not going to go into it. But you need to look at your nutrition and what you're putting in your body, because you need the healthy, good foods and you need the hydration. And you need to be kind of trying to minimize the things that would have a negative impact on wound healing. Okay. So if you do a search or talk to a nutritionist or a dietitian about even just general wound healing, what the recommendations are, irrespective to postpartum, that's not a bad idea, right? Because you have a wound that's healing. So nutrition is huge. Sleep is huge, right? Rest. Your body needs to be healing this area just like it would after a surgery. And your body does its best healing work when you're asleep. So I know you have a newborn, it's hard to sleep, right? But this is just one more reason for you to be really trying to guard and protect your sleep in that postpartum phase, and sleeping in good positions, right? Okay, let's sleep in positions that are not placing a lot of strain on that perineal tissue. So ergonomics is one of the things that I always talk about with my newly postpartum mamas, especially the ones who want to come in real early, like 2 or 3 weeks postpartum, or they want to see me via a virtual visit really early to just talk about what can I be doing to like help my my recovery be proactive. Well, let's talk about what positions you're sitting and sleeping in, and keeping the pressure off of these healing tissues, right, is important. So we talk about in that early phase, just like with any other wound or injury, if you've heard RICE, right? RICE is rest, ice, compression, and elevation. It's an old school, like, what do we do with a fresh new acute injury, right? And there's maybe some controversy about a couple of them, but it's a good kind of rule of thumb. So rest, we've just talked about, you need to rest that area. You need to not be stressing it out as much as possible. And for your perineum, that means that you're not loading it with too much heavy lifting. You're not trying to like walk a mile 3 days after you had a tear, okay? You're letting that tissue rest. Because remember, your pelvic floor is not just bowel and bladder and sexual function. It is also a core stability muscle. So if you're out there walking and pushing a stroller, you're loading your pelvic floor, okay? So you probably shouldn't be doing that if you had a grade 3 tear a week after the tear. Okay, so you're not overloading the tissue, you're resting it, preferably in good ergonomic positions, spending a lot of time laying down, so gravity eliminated, right? So that that tissue can not have to be fighting gravity for most of the day. So you've heard of like the 5 days in bed, 5 days around the bed. Okay, that totally goes hand in hand with what I'm telling you right now, is to try to rest that perineal tissue, especially if you have higher stage tear in those first few weeks. Ice, using a cold pack, right? They give you those at the hospital. So the cold pack can be really, really relieving. You don't want to have ice directly on the skin or directly on the wound for more than like 10 minutes at a time, because then you're looking at potentially doing some nerve damage or causing ischemia. So, but cold compress is great. And the compress, right? So compression is another thing that is really good for that wound, especially since you have to be up and about and nursing your baby and potentially caring for other kids, during early after a birth. So you can't have complete rest and you can't have compression all the time. So, doing some compression when you are resting, when you're sitting down, putting one of those nice round firm cold packs they have right under the perineum as you sit feeding your baby, being in a good position sitting, so not slumped back on your tailbone and on your levator ani. So when you sit in a slumped position, you're sitting on all of these muscles and on your tailbone, and that can cause ischemia. If you're not familiar with that term, it's a lack of blood flow to those muscles and those healing tissues. We want blood flow. Blood flow is how your body heals that area. So we want to be sitting up in a good posture, supported in a good posture, not in a bad posture that's going to compress the tissue that's trying to heal. So rest, ice cold compression. You can also compress using things like a V-belt or it's called a pelvic press by It's You Babes. There's different belts out there that have some support, some upward support to compress that perineum to help, right, with comfort and with healing. And then elevation. So, you're already spending some time, and that is, relatively speaking, you laying down is going to be more elevated than you standing up or sitting, because you're elevating that pelvic floor and you're putting it in a gravity eliminated position. But if you're really uncomfortable, potentially spending some time with your hips up on a pillow, laying down so that your pelvis is actually higher, so you're elevating that area that's trying to heal, is another option, okay, for that. So in that early phase, we want to be rising, rest, ice, compression, and elevation. So now let's talk a little bit about moving into that remodeling phase, because of course I'm running over my 30 minutes again, which I always do. So remodeling or maturation. So now we're talking about what can we do a little bit more proactively. Okay, so your muscles should be turning on again at this point. You should be able to activate your pelvic floor and feel your pelvic floor at this point. And then we start to talk about Wolff's Law, which is an age-old law, right, about tissue healing in the body. The tissue is going to get stronger based on the load that's placed on it. So now when you have a nice scar starting to form, now we want to talk about how can we effectively and appropriately load that tissue to help it remodel and mature in the best possible orientation and get stronger, again, to prepare you for when you get that 6-week clearance and you want to go start lifting and go to the gym and do all these things. Like, you want to do some work leading up to that to make sure that, especially if you had a 3rd or 4th degree tear, that these muscles and fascia and ligaments are prepared for you to start to load them a little bit more, okay? So we want to start loading with really simple protective things. Can you turn on your pelvic floor? Can you relax your pelvic floor? So that shortening and lengthening of the tissue is going to stimulate your body to lay down muscle fiber and tendon and fascial fibers in a good orientation to respond well to those natural forces that are supposed to go through it with normal day-to-day function, like breathing and walking and squatting, right? So those are all daily tasks that we all do. So to start to walk and squat when that feels comfortable, to start to do some active pelvic floor contract and relax with your breath, right? Is something that you want to start to do as soon as it's comfortable. So in that first week to 2 weeks, it's fine to start doing those as long as they're comfortable. And again, I would refer you to preferably having seen a pelvic PT prior to your birth to know how to do that and to how to feel that you're doing it correctly. We don't have time to talk about that today, but starting some of that early on so that when you're walking and you're doing squatting and you're starting to move into these more whole body motions at weeks 3 and 4 and 5, that you know how to feel that the tissue is activating well and not bulging and bearing down. You're not breath holding, because that breath holding is going to it's the opposite of compression, right? You're bulging that tissue out, and that's not going to promote good healing. We want that tissue being kind of shortened and lifted when you load it versus lengthened and stretched. So starting to do in that remodeling phase, again, active pelvic floor mobility of contracting and relaxing, making sure you have good connection, other core types of strengthening to start to stimulate the fascia and the tissue to remodel and rebuild. So there's a lot of active things that we can do. And then also starting to look at after you have your 6-week clearance, because we definitely want to make sure that your physician or your midwife at that 6-week mark, they usually will look at, right? How is that wound healed? Do you have a good scar laid down? Does that scar look nice and normal and strong and solid? And that's what they're looking for you to give you that clearance, right? It's okay to have sex. It's okay to go exercise. It's okay to do what you want to do. We're not worried about infection. We're not worried about you popping a stitch or anything like that. The wound looks good, right? That's what they're telling you at that 6-week mark. They're not telling you your pelvic floor is strong. They're not telling you that your scar has 100% strength of what your pelvic floor had before pregnancy. They're not telling you that your pelvic floor is functioning well. They're not telling you that there's zero risk now of injury. They're not telling you that the wound and the scar is back to normal. That's not what they're telling you. They're telling you that the risk of you re-injuring at that tear or that scar, they're not worried about that at that point, okay? So It's not that it's fully healed. It's definitely not that it's 100% strength of prior to birth or pregnancy. It's that wound, they're happy with the wound healing at that mark. Okay. So that's really important for you to know that that's what's happening at your 6-week checkup. And, when they clear you for that. And that's when we can start to do some manual things, right? So let's start to mobilize the scar. If you have any keloid or any hypertrophic scar forming, we can teach you how to mobilize that scar, how to do a little bit of rolling on it to manually stimulate the tissue to break down any excess or negative looking scar tissue that's there, any painful scar tissue. If you have scar tissue over a nerve that's potentially causing you some pain, if you have muscles that have tightened or spasmed and are pulling on that scar, because that's super common after childbirth to have muscle tightness there. And all of those things can contribute to pain with intercourse, right? When you go back to that after your 6-week clearance, a lot of women are scared about that too. And this is one of the reasons, right? Because if you have an uncomfortable scar there that has not been attended to, then you have a lot higher chance that intercourse is not going to feel great, right? So there's a lot of things that we can do manually or teach you how to do manually to help that scar and that tissue that's now just barely healed, heal in a more positive and proactive and healthy way. Okay. So, I'm going to try to wind up in a second here, but we've talked about stimulating actively, contraction and with manual massage to stimulate blood flow through the muscles, through the fascia, with scar mobilization. And then we want to talk about progressive loading, right? So after that initial 6 to 8 week period, you feel great. You're going for walks. Potentially you started to try to do a little bit of weightlifting or whatever type of exercise you like, right? Because you got the clearance from your physician and now you want to do something. So we want to progressively load that tissue and make sure that you're using a good pattern of shortening the tissue and lengthening the tissue as you perform different movements, whatever those movements are, whether they're Pilates style or CrossFit style, whatever, or running, whatever the movements are. We want to make sure that you are effectively loading, shortening, and lengthening that tissue over time. So for that first 6 to 12 months, again, we talked about the tissue's not back to its normal strength. So we still want to be a little bit mindful of protecting it for that first 6 to 12 months when we have an influence over how that tissue is healing. Okay. So progressive, positive loading of the tissue over that long period of time that is entailed in your remodeling and your maturation phase. So a couple of things I wanted to mention that I've seen with some clients who have persistent pain and they come in and see me for that, maybe a few months after their birth. One thing is granulation tissue. So, we talked about that earlier, granulation proliferation phase where you have some raw tissue there. It's raw, right? So it's still kind of an open wound that can sometimes persist. So I'll have women come in and see me 3-4 months postpartum. They still have pain with intercourse. We'll do that pelvic floor internal vaginal assessment and I will see some raw unhealed tissue there. Okay. That's a scenario where I'm probably going to refer you back to your provider, your OB or your midwife to check that out. There's things that they can do from a medical standpoint that can potentially really quickly help that granulation tissue heal and go back to normal. Okay. So that's a scenario where I would want you to see, your physician. But the thing is, you don't usually see them after your 6-week checkup, right? They're kind of like, oh, you're done. We're done. Graduated. Great. You call them, you say, I'm having some pain with sex. Oh, that's normal. Give it 6 to 12 months. Pain with sex is normal. Use some lubricant, right? Well, lubricant's not going to help if you've got still a little bit of an open wound. So come in and see us. We're happy to see you at any point postpartum. We'll check it out for you. We'll tell you if you've got something that looks concerning that we want you to potentially go back and see your provider for. So that's one thing. Potentially stitches, you can still have a little bit of a stitch, right? They sometimes don't dissolve the way they ought to. So that can be a reason why you have persistent pain. They're checking obviously for infection, right? So if you have any type of infection, that's definitely something that you need to see the doctor for. And you want to let them know if you think you might have infection in those early days. One of the things I've been a little bit disappointed about in the past couple of months, ACOG in the US in general, physicians and midwives and everybody's leaning more towards more postpartum care. Let's see our mamas more times in that first 12 weeks. We want to see you at or at least talk to you on the phone at 2 weeks, 4 weeks, then a 6-week checkup, and then we're still checking up with you at 10 weeks or 12 weeks, more follow-up, okay, more support. Unfortunately, one thing I've seen, because I see a lot of military clients, or, military and military spouses, and one thing that they've been telling me is that they're no longer getting a 6-week checkup at our local hospital, which is Balboa. So now they're only apparently doing a routine 2-week checkup. Well, if you think back to those phases of healing, at 2 weeks, you're not even through that proliferative granulation phase. So we don't even really know at 2 weeks postpartum if that's going to follow a normal trajectory. So they can tell you you don't have an infection, but they can't tell you that your wound is fully healed at 6 weeks when you're cleared to go back to intercourse, right? So, if you're still having pain persistently, and especially if you aren't getting a 6-week checkup or you didn't get one and that's not part of your provider's plan, please do let them know if you're having persistent pain and you think something's not right within that first few months postpartum, because you might have something that does need to be assessed by your medical provider. So those are just kind of some troubleshooting issues that can happen. Okay. So this is a lot of information, but again, there's so much more we could say about all of this, right? But hopefully that gives you a better understanding what happens with a laceration. How does your body heal? And yes, your body has the tools to heal this. Yes, there are things that you can do to be proactive in each different phase of your body's natural healing process to help it heal better. And so hopefully you have a better understanding. Look at the comments. Hopefully you have a better understanding of that now, what the grades are of tearing, what to do in each phase, and what we can do, kind of even for up to a year to help this tissue heal better. Okay. And you might need some scar massage. You might not be able to do that effectively on your own. So seeing someone who's qualified to help you do that, walk you through how to do it effectively, because it's not the same for every person, right? Mama over here might need this type of massage. Mama over here might need this type of mobilization. There's a lot of different techniques, a lot of different ways of stimulating that tissue. And all perineums are not equal. All wounds are not equal, okay? So that's something you really want to see a qualified provider to get individual instruction on what's the best option in your scenario. So I'm just going to look quickly at the comments. So now is the time, if you do have a specific question, I actually have a client in about 10 minutes, so I'm going to have to hop off. But if you do have a specific question, then please go ahead and put it into the comments. One had asked if I can link you the evidence-based birth, and I will link that in the comments a little bit later today. And then if with the baby, I didn't even see my OB. Yeah. So, and especially if you have concerns or if you have a history of a large tear, and this is a second or third birth for you, if you have any kind of concern about your perineal healing, it'd be kind of nice to see your birth provider, right? But if for whatever reason your system doesn't allow you to do that, if you have an HMO and that's just the way they do things and you're not seeing that provider unless you're bleeding, we're happy to assess you and try to help you have more reason to go in and say to the team at your hospital or at your medical group, look, I've seen this provider. She sees unhealed tissue and says, I need to see my physician, right? So we're happy to help with that. Would you wait until after the swelling is gone to use a pelvic press belt, or can you start in the first couple days? You can absolutely start wearing that in the first couple days. So think about if you had a big gash on your arm and you went to the ER, they would wrap it, right? They would wrap it right away to stop the bleeding. Right? Compression is one of the ways that we stop the bleeding. So it's totally fine to wear, and those compression type of belts that put a little bit of pressure, they can't, physically, if you just look at the way your pelvis is and the fact that you're standing up, they can't put that much pressure on the perineum. Okay. So it's just a little bit of an extra help. So it's totally fine to wear the pelvic press, or the V-belt is another brand. I'm sure there's other brands out there that I'm not familiar with, but totally fine to put that on. And a lot of my ladies who have maybe a history of prolapse, where you're a little bit more concerned about the descent, or if you had a really long pushing phase and you just feel unstable and things are kind of falling out and loosey-goosey, putting on that nice supportive V-belt or pelvic press belt can be a really great way to just relieve some of your symptoms in those early days. So yeah, and I'm talking about a perineal compress, right? So not necessarily an abdominal binder. We can have a different conversation about those, but something that is lifting your perineum. Yeah. Okay, any other questions? And yes, those can be helpful for swelling as well. But even just sitting, like I said, sitting on a towel roll or like a little cold pack, to help with the swelling would be great. And then again, active, as soon as you can comfortably do an active pelvic floor contraction and relaxation, that muscle pump is going to help with swelling, right? So again, you want to monitor your swelling. So if you're doing too many of them, your swelling might go up. But if you're doing the right number and the right intensity and the right amount, they can help with the swelling as well. Okay. So can elevation. So getting your hips above your heart, just like with any other injury, with an ankle injury, what do? We elevate your ankle, right? To get the swelling down. So putting your pelvis above your shoulders, laying down on your bed and using a pillow to elevate is another thing that you can do for swelling in those first couple of days. Okay. You want to be, note any kind of symptoms of like hypotension or hypertension, things like that. So again, it's hard to say anything on a scenario like this because I have to be careful what I say. This is not medical advice, okay? This is education tools for you guys. All right, so I'm gonna have to hop off. If there's any last minute questions, go ahead and type them in the comments and I will post those links later on today. Hopefully this was helpful for you guys. Feel free to share it with your friends who are about to birth, pregnant women. Is it scary? Yes. Is it better to be educated? Yes. Right? It's better to know the things that might happen going in than to have no idea and be totally caught off guard afterwards and be totally emotionally traumatized because you didn't know what to do about it, right? Okay, I've also heard it's good to keep your legs together during initial healing and not sit cross-legged. Okay, so there's definitely some good biomechanical reasons for that. And this is going to vary person to person, right? But when you abduct or you take your legs wide, you're potentially placing more strain. So you have to remember the fascia that starts in your inner thighs, that fascia comes all the way up and is intertwined with all of the fascia on the front side of the pelvis, around the pubic bone, through where the urethra, the opening is. So if you have especially your periurethral tear, right, or a tear in the anterior, the front side, then if you put strain on that adductor fascia by going really wide with your legs, that might not feel great on your tear. Okay, so that's going to potentially put some too much stretch on your tear. But if you have a posterior tear, levator ani tear, then hip external rotation isn't necessarily going to be uncomfortable for various biomechanical reasons, right? The way the fascia runs and where the muscles go, what strain they put where. So I would say in that scenario, probably best to listen to your body. If it's comfortable, it's probably okay to do. Right? Would I go into a really wide, like a yoga or dancers like adductor stretch? No, I wouldn't recommend doing that in the first couple days birth. I would recommend staying in nice neutral positions and generally keeping your legs together. But personally, I had no issue with sitting cross-legged within a week. And I did breastfeed a lot sitting cross-legged. So, my body tolerated that just fine. I had a stage 1 tear with my first and a stage 2 with my second. So, it's going to depend a lot on the tear, on your body. Do you have really tight adductors and tight fascia there? So again, that's I think an individual question. I wouldn't say that it's a general contraindication. If it's comfortable for you and it's a comfortable position and it feels good, it's probably okay. Okay. And again, I haven't seen any research on that. So that's a personal opinion based on professional education. Oh, good. I'm glad it's helpful. Okay, awesome. So I'm going to wrap up now. But if you have any questions, as always, feel free to email me. Feel free to send me a private message. We are open in San Diego and seeing clients, and we are also able to see for physical therapy anyone in California virtually as well to walk you through some of this. So if you just had a baby 3 days ago and you're like, what the heck do I do now? We're happy to see you online and do an assessment for you. To help you out with how to heal well. So have a great day. Have a great rest of your weekend. And again, I'm doing these every week. So if there's a topic that you want covered, if there's something you want to learn more about, please do comment or shoot me a message and let me know that you'd like to do one of these Facebook Lives on something specific, and I'm happy to address it. Hope you guys have a great day, and we will see you soon.